Kidney stone pain relief at home. Kidney stones develop when dissolved minerals build up inside the kidneys. A low fluid consumption, dietary factors, and a person's medical history may contribute to their development. Kidney stones may be small and pass unnoticed through the urinary tract, but some grow to the size of a golf ball. Larger stones can cause severe pain as they leave the body. Without treatment, kidney stones can lead to urinary problems, infections, and kidney damage. Kidney stones are a common problem in the United States, and the incidence appears to be growing. Dietary factors and climate change may contribute to this increase, according to one study. In this article, we look at how to recognize kidney stones and explain what to do if they occur. Symptoms. Choice Graph X, Getty Images. Kidney stones do not always cause symptoms. A person may pass very small stones out of the body in the urine without being aware of them. When symptoms appear, they commonly include pain in the groin, the side of the abdomen, or both, blood in the urine, vomiting and nausea, a urinary tract infection, UTI, fever and chills. If there is an infection and increased need to urinate. If kidney stones block the passage of urine, a kidney infection may result. The symptoms include a fever and chills, weakness and fatigue, diarrhea, cloudy, foul-smelling urine. If a person has any of these symptoms, they should seek medical help at once. Learn more about the early signs and symptoms of kidney stones. Complications. When kidney stones remain inside the body, complications can develop. If they block the tube that connects the kidney to the bladder, urine will not be able to pass out of the body. This dysfunction increases the risk of a UTI or kidney infection. If recurring kidney stones cause blockages in the urinary system, this can increase the risk of chronic kidney disease. About 50% of people who have had a kidney stone develop another one within 5 to 7 years. Causes. There are 4 different types of stone: calcium, uric acid, struvite, and cystine. Calcium stones form when the kidneys retain the excess calcium that the muscles and bones do not use, rather than flushing it out of the body. The calcium combines with other waste products to form crystals, such as calcium oxalate, which clump together to make a stone. Uric acid stones result from a lack of water in the body. Urine contains uric acid. When there is not enough water to dilute the uric acid, the urine becomes more acidic. Struvite stones can form after a UTI. They consist of magnesium and ammonia. Cystine stones develop when cystine, a substance present in the muscles, builds up in urine. These are rare. The American Urological Association say that people who are susceptible to kidney stones should consume enough fluid to produce 2.5 liters, L, or about 85 ounces, Oz, of urine each day. On average, this means consuming close to 3 L, or about 100 ounces, of fluid a day. Not all of this needs to come from water. Risk factors. Apart from dehydration, factors that increase the risk of kidney stones include a family or personal history of kidney stones. Being aged 40 years or older, although they can sometimes affect children's sex, as they are more common in males than females. A diet that is high in protein and sodium. A sedentary lifestyle. Obesity, diabetes, high blood pressure, pregnancy, recent surgery on the digestive system. Health conditions that affect how the body absorbs calcium, such as inflammatory bowel disease and chronic diarrhea. Various medications, such as allopurinol, xylopram, and topiramate, Topamax, can also increase the risk. People should check with their doctor if they have concerns about any medications they are taking. Diagnosis. Various tests can show whether a kidney stone is present. A physical examination may identify the kidneys as the source of pain. Urinalysis can reveal blood in the urine or signs of an infection. Blood tests can help identify complications. Imaging tests, such as a CT scan or ultrasound, will reveal any structural changes. Imaging tests can help doctors determine whether a stone is present, the size and location of any stones, whether there are any blockages, the condition of the urinary tract, whether complications have affected other organs during pregnancy. An ultrasound is preferable to a CT scan, as it does not involve radiation. Here, find out what kidney stones look like. Treatment will focus on managing symptoms and removing the stone. There are various ways to do this. Treatment may involve a high intake of fluids by mouth or intravenously pain relief medications to help speed up the passage of stones. How long do kidney stones take to pass? Large stones may need other types of intervention, such as shock wave lithotripsy, SWL, ureteroscopy, or percutaneous nephrolithotomy, PCNL. SWL involves the use of ultrasound waves to break the stone into smaller pieces to make it easier to pass. If a doctor opts to use ureteroscopy, they will pass a long, thin tube through the person's urethra as far as the ureter, which connects the bladder and the kidney. They will then use laser energy to break up the stone. PCNL involves passing a long, thin instrument through the back and into the kidney, where it can break up or remove the stone using laser energy. This procedure requires general anesthesia. There may be a risk of complications, such as an infection, after removing a large kidney stone. A doctor should explain the possible complications beforehand so that if any develop, a person can recognize the signs. Home remedies. A person can usually treat small kidney stones at home. A doctor may recommend drinking plenty of fluid and waiting for the stone to pass, using over-the-counter drugs to relieve pain and nausea, taking alpha blockers to help the stone pass more quickly, avoiding salt and sodas. They may advise the person to continue to drink plenty of fluid after the stones have gone to prevent new ones from forming. Medical News Today newsletter. Stay in the know. Get our free daily newsletter. Expect in-depth, science-backed top lines of our best stories every day. Tap in and keep your curiosity satisfied. Enter your email. Your privacy is important to us. Diet and natural remedies. Some foods may benefit kidney health and help reduce the risk of kidney stones. Herbs and Spices Guidelines from the American Family Physician, AFP, note that people have long used herbal remedies for kidney stones. However, there is uncertainty regarding their safety, effectiveness, and possible interactions with other drugs. The AFP add, though, that phytonutrients in green tea, berries, and turmeric may help prevent infection. Parsley may boost urine production. Agropyron repens, couch grass, may help flush out the urinary tract. Proponents of natural remedies note that other foods and supplements that may help protect the kidneys include basil, celery, apples, grapes, pomegranates, vitamin B6 supplements, pyridoxine supplements. Some research suggests that vitamin D deficiency is common among people with kidney stones, but there is not enough evidence to show that vitamin D supplements are safe or effective for preventing stones. Do kidney beans help? Some people drink kidney bean broth to help the stones pass. People can make the broth by boiling the pods inside the beans for about 6 hours and then straining them. Once the liquid has cooled, they can consume some every 2 hours for 1 to 2 days. However, it is important to note that there is no scientific evidence to confirm that this is effective. Foods to avoid. Limiting foods that contain the following substances may help prevent stones from developing: protein oxalate, sodium, salt, sugar, such as high fructose corn syrup. Vitamin C supplements. Oxalate is present in many common foods, such as nuts, rhubarb, beets, miso, tahini, Swiss chard. However, people should not completely avoid foods containing oxalates, calcium, and protein, as they can have other nutritional benefits. Learn more about the kidney stone diet. Prevention. Kidney stones are not always preventable, but experts recommend that people reduce the overall risk by drinking at least 2 liters of water each day, following a healthful diet, doing regular exercise. For those with a higher risk of developing kidney stones, a doctor may make dietary recommendations or prescribe medication. Get more tips on preventing kidney stones. Takeaway. Kidney stones are a common problem. Not drinking enough fluid is a major causative factor, but dietary habits, obesity, and a sedentary lifestyle can all contribute. Anyone who has symptoms of a kidney stone, urine infection, or kidney infection should seek medical advice to prevent complications from developing. Advertisement. Urology, nephrology. 11 sources collapsed. Medically reviewed by Angela M. Bell, MD, FACP. Written by Peter Crosta, Updated on December 3, 2020. Latest news: how did we develop a COVID-19 vaccine so quickly? Christmas 2020. How to protect mental health, heart health. Mediterranean versus low-fat diet: how the thalidomide scandal led to safer drugs, long COVID and periods, the unspoken impact on female well-being. What is renal colic? Symptoms and relief. Symptoms, causes, treatment and types. Pain management, prevention. Outlook: renal colic is pain that occurs due to a stone in the urinary tract. The urinary tract includes the kidneys, ureters, urinary bladder, and urethra. Stones can develop anywhere in the urinary tract, and they can vary significantly in size. Most stones occur due to a buildup of minerals or other substances, such as uric acid, which stick together in the urine and create a hard mass. There are several treatment options for urinary stones. However, as many stones pass without surgery, the management of renal colic is often the primary concern during treatment. In this article, we explain how to recognize renal colic, what causes it, and ways to treat it. Symptoms: a person with renal colic may experience pain or difficulty urinating. The symptoms of renal colic vary depending on the size of the stone and its location in the urinary tract. Some small stones cause mild renal colic, and a person can pass them in the urine without much discomfort. Larger stones can cause severe pain, especially if they become stuck and block any small passages in the urinary tract. Susceptible areas include the ureters, which are the tubes through which the urine passes between the kidney and the bladder. The most common presentation of renal colic is pain on the affected side of the body between the lower ribs and hip. This pain tends to radiate to the lower abdomen and groin. The pain typically comes in waves that each last 20 to 60 minutes before subsiding. Renal colic is just one of the symptoms that urinary stones can cause. Other symptoms that commonly occur alongside renal colic include pain or difficulty urinating, blood in the urine, which may make it appear pink, red, or brown, urine that smells unusual, nausea, vomiting small particles in the urine, feeling a constant urgent need to urinate, cloudy urine, urinating more or less frequently than usual. Symptoms of a related urinary tract infection, UTI, may occur for some people. These include fever, chills, and a cold sweat. Anybody experiencing any of these symptoms should talk to a doctor. Anyone experiencing the following symptoms alongside renal colic should contact the emergency medical services or go to the emergency room immediately. A complete inability to urinate, uncontrollable vomiting, a fever higher than 101 degrees Fahrenheit causes renal colic, occurs due to a stone becoming lodged in the urinary tract, which commonly occurs in the ureter. Here, the stone stretches the surrounding area of tissue while trying to pass through, which can be painful. In addition, restricted urine flow may cause inflammation and increased pressure. The ureter may also spasm, causing pain. Several different chemicals and minerals can make up a kidney stone. Stones develop due to a few different risk factors, including extra calcium in the urine, diseases of the gastrointestinal, GI tract, such as Crohn's disease or ulcerative colitis, gout, which occurs due to an excess of uric acid, certain medications, cystinuria, in which stones develop from an amino acid called cysteine, obesity, surgeries of the GI tract, such as a gastric bypass, dehydration, a family history of urolithiasis, treatment and types. Doctors will often use blood tests to check for increased levels of stone-forming substances in a person's body. An imaging test can help locate any significant stones in the urinary tract, such as a plain film X-ray, CT scan, or ultrasound. Medical treatment will often depend on the type of stone. There are several different types of stone, including calcium stones. These are the most common types of stone and consist of calcium oxalate. Uric acid stones. These stones develop when uric acid concentrates in the urine. Cysteine stones. Cysteine stones are rare and occur due to cystinuria. Struvite stones. Bacteria in the urinary tract can cause struvite stones, although these are also less common. People can pass most small stones in the urine. Doctors will recommend hydration, and they may prescribe pain-relieving medications to help a person deal with the pain. They will monitor the person until the stone passes. A range of procedures can help a person remove larger stones and relieve renal colic. These include ureteroscopy-guided stone extraction. This invasive surgical procedure involves a doctor inserting a thin scope with a light and attached camera into the urinary tract. Using this allows them to locate and remove the stone. Extracorporeal shock wave lithotripsy, ESWL. ESWL is a non-invasive treatment. It is the process of aiming small sound waves at the kidneys to break up stones into tiny pieces. A person can then pass these fragments in the urine. Percutaneous nephrolithotomy. Doctors typically perform this procedure under general anesthesia. They will make a small incision in the person's back to access the kidney and will remove the stone using a lighted scope and small surgical instruments. Stent placement. Sometimes, doctors place a thin tube into a person's ureter to help relieve the obstruction and promote the passing of stones. Open surgery. Some people who cannot pass the stones may require open surgery. However, this has a longer recovery time than other procedures. Doctors will often try to extract or break up the stones so that a person can pass them before considering open surgery. Treatment may also include medications that help relieve symptoms or reduce the buildup of stones. These treatments may include antibiotics, alkalinizing agents, corticosteroids, calcium channel blockers, selective alpha-1 blockers. A person can take several steps to help prevent kidney stones. Learn more here. Pain management. Pain management is an essential step in treatment, as it can improve a person's quality of life until the stone passes. Doctors may also recommend medications to calm the GI tract and manage any nausea and vomiting. Placing a heat pack on the side or lower back may calm the muscle spasms that can occur in people with renal colic. Medical News Today newsletter. Stay in the know. Get our free daily newsletter. Expect in-depth, science-backed top lines of our best stories every day. Tap in and keep your curiosity satisfied. Enter your email. Your privacy is important to us. Prevention. Avoiding renal colic starts with preventing the stones that cause the symptoms. A doctor may prescribe a thiazide diuretic if a person has a tendency to develop calcium oxalate urinary tract stones. In other cases, they may recommend that people increase their fluid intake and reduce the sodium in their diet. Drinking more fluid may not always improve renal colic or help flush stones out of the urinary tract, but it will, at least, prevent dehydration. Many people benefit from eating a healthful diet that is rich in a variety of whole grains, vegetables, fruits, and lean proteins. Doctors may also advise people to increase their intake of citrus fruits, such as oranges, lemons, and grapefruits. Learn about the links between diet and kidney stones here.